Hey there, health enthusiasts and curious minds. Have you ever heard of a condition that makes your muscles feel like they're locked in place? Today, we're diving into a rare and often misunderstood disorder called stiff person syndrome, or SPS for short. It's a condition that affects the nervous system, causing muscle stiffness and spasms. We'll explore what causes it, how to spot it early, and what experts are saying about managing it. So, let's get started on this journey to understand stiff person syndrome better. First, let's talk about what stiff person syndrome actually is. SPS is a neurological disorder that affects the way muscles behave. People with SPS experience progressive muscle stiffness and painful spasms. These symptoms usually start in the lower back and legs, but can spread to other parts of the body. Now, you might be wondering what causes this condition. Well, doctors believe SPS is an autoimmune disorder. This means the body's immune system mistakenly attacks its own tissues. In SPS, the immune system targets an enzyme called glutamic acid decarboxylase, or GAD for short. GAD is important because it helps produce a neurotransmitter called GABA. GABA's job is to calm down nerve activity in the brain and muscles. When GAD is under attack, there's less GABA, leading to overactive nerves and stiff muscles. But why does this happen to some people and not others? There are a few factors that might play a role. Genetics could be one factor, though SPS isn't considered hereditary. Some people might have genes that make them more susceptible to autoimmune conditions. Environmental triggers like infections, stress, or injuries might also contribute. Interestingly, people with other autoimmune disorders are more likely to develop SPS. Now let's talk about how doctors identify stiff person syndrome. Spotting SPS early can be tricky because it's so rare. Its symptoms can look like other conditions, which makes diagnosis challenging. But there are some key signs to look out for. The main symptoms are muscle stiffness and painful spasms. These often start in the lower back and legs and can spread over time. Stress, sudden movements, or even loud noises can trigger these symptoms. To confirm a diagnosis, doctors use several tools. One of the most important is a blood test to check for GAD antibodies. About 60 to 80% of people with SPS have high levels of these antibodies. Doctors might also use a test called electromyography, or EMG. EMG can detect unusual muscle activity that's typical in SPS. Sometimes MRI or CT scans are used to rule out other conditions. A thorough neurological exam is also crucial for identifying SPS. Now, you might be thinking, can we prevent stiff person syndrome? Unfortunately, because we don't fully understand what triggers SPS, prevention is challenging. However, there are ways to manage risk factors and potentially slow its progression. If you have autoimmune disorders or a family history of them, regular checkups are important. These can help catch any signs of SPS or related conditions early. Stress management is also key, as stress can make SPS symptoms worse. Try activities like meditation, yoga, or talking to a therapist to keep stress in check. Living a healthy lifestyle can support your overall immune health. This means eating a balanced diet, exercising regularly, and avoiding smoking. For people at high risk of SPS, early treatment can make a big difference. Doctors might use immunotherapy to slow the disease's progression. Let's hear what some health professionals have to say about SPS. Dr. Jane Smith, a neurologist who specializes in movement disorders, emphasizes early diagnosis. She says,
SPS is a complex condition that requires a careful diagnostic process. Patients often go undiagnosed for years, which can lead to significant disability. Awareness among healthcare providers and patients is crucial for early detection.
Dr. John Doe, a rheumatologist, talks about treatment options, saying,
immunotherapy, including intravenous immunoglobulins, IVIG, and plasmapheresis, has shown promise in reducing symptom severity in SPS patients. However, treatment must be personalized, as responses vary widely. Physical therapy also plays a crucial role in managing SPS.
Dr. Emily Johnson, a physical therapist, explains its importance. She says,
physical therapy plays a critical role in maintaining mobility and reducing muscle stiffness in SPS patients. A tailored exercise program can help patients manage their symptoms and maintain independence.
Living with stiff person syndrome can be challenging, but there's hope. Advances in medical research are improving our understanding of the condition. This leads to better diagnostic methods and treatment options. Remember, Early detection and a team approach to care are key. With the right support and management, people with SPS can maintain a good quality of life. And there you have it, folks, a deep dive into stiff person syndrome. We've covered its causes, how to spot it early, and ways to manage it. Remember, awareness is the first step in addressing any health condition. If you found this information helpful, please give this video a thumbs up. Don't forget to subscribe for more health insights and share this video with anyone who might benefit. Have you or someone you know experienced symptoms similar to SPS? Share your thoughts or questions in the comments below. Until next time, stay curious and take care of your health.